Did you know that over 30,000 Americans will suffer from a ruptured aneurysm this year, and nearly half won't survive the first 24 hours? Today, I'm going to reveal the 3 critical medical tests that can detect a hidden aneurysm before it ruptures, potentially saving your life or the life of someone you love. I'll also share one simple home assessment that could alert you to a potentially dangerous aneurysm that your doctor may have missed during your last checkup. Martha, a 68-year-old retired teacher from Michigan, had no symptoms at all when a routine screening discovered an aneurysm the size of a grape in her brain. 3 weeks after successful treatment, her doctor told her it could have ruptured at any moment, potentially taking her life without any warning. Topic 1. Why aneurysms are silent killers for seniors. Why are aneurysms especially dangerous for adults over 60? This is a critical question that too few seniors are asking their doctors. An aneurysm is a bulge in the wall of a blood vessel, similar to a weak spot in a garden hose that balloons out under pressure. These dangerous bulges can form in any blood vessel, but they're most common in the brain and in the aorta, the main artery that carries blood from your heart through your chest and abdomen. The danger lies in their silent nature. They typically cause no pain or symptoms while they're forming and growing. According to the Mayo Clinic, aneurysms can develop slowly over decades with absolutely no symptoms until the moment they rupture, making them particularly deadly for seniors who may have been developing these weaknesses for years without knowing. Without proper screening, a weakened blood vessel can continue to bulge until it suddenly bursts, causing severe internal bleeding and potentially death within minutes. What makes this especially concerning for seniors is that the risk factors accumulate over time. The longer you've had high blood pressure, the more years you've smoked, or the longer your blood vessels have been subjected to stress, the higher your risk becomes. Once an aneurysm ruptures, the statistics are grim. The Brain Aneurysm Foundation reports that about 40% of ruptured brain aneurysms are fatal, and among those who survive, about 2/3 suffer permanent neurological damage. For abdominal aortic aneurysms, the mortality rate is even higher if rupture occurs, approximately 80–90%, according to the Society for Vascular Surgery. Understanding your personal risk factors is the first step to prevention. Age over 65, high blood pressure, smoking history, and family history are the most critical to know. Take a moment right now to mentally check how many of these apply to you. If you have even one of these risk factors, you should discuss screening with your doctor. High blood pressure in particular puts constant strain on your blood vessels, potentially weakening them over time. Smoking damages blood vessels and increases the risk of aneurysm formation by up to 4 times. Family history matters too. If a parent, sibling, or child has had an aneurysm, your risk is significantly higher. Richard ignored his doctor's advice about checking his blood pressure and continued smoking until a sudden, excruciating headache sent him to the emergency room with a ruptured brain aneurysm. After weeks in intensive care and months of rehabilitation, he now tells everyone he meets about the importance of screening. The time to assess your risk isn't after symptoms appear. By then, it could be too late. Make a commitment today to know your numbers, especially your blood pressure. If you've been avoiding regular checkups, pick up the phone right now and schedule an appointment with your primary care physician to discuss your aneurysm risk. For most people, a simple conversation and a few basic tests can provide enormous peace of mind or catch a potential problem before it becomes life-threatening. Don't postpone this critical step another day. Topic 2. The ultrasound test that's saving thousands of lives. What is the simplest, most affordable test that can detect the most common type of dangerous aneurysm? The answer is abdominal ultrasound screening, a quick, painless procedure that has become a true lifesaver for thousands of seniors across America. This test uses sound waves to create images of the structures inside your body, focusing particularly on the aorta as it passes through your abdomen. Johns Hopkins Medicine confirms that abdominal ultrasound screening is highly effective at detecting abdominal aortic aneurysms, the most common type in seniors, with nearly 100% accuracy when performed by experienced technicians. The ultrasound can measure the exact size of your aorta and determine if there's any abnormal bulging that could indicate an aneurysm, all without any radiation, injections, or invasive procedures. Missing this simple screening could leave a potentially fatal abdominal aneurysm undetected until it ruptures, which carries a 90% mortality rate if it happens outside a hospital. The statistics tell a compelling story. Studies have shown that appropriate screening and treatment of abdominal aortic aneurysms can reduce mortality by up to 50%. What makes this screening particularly valuable is that it can detect aneurysms years before they become dangerous, allowing for careful monitoring or preventive treatment. The U.S. Preventive Services Task Force specifically recommends this screening for men ages 65 to 75 who have ever smoked, as they're at the highest risk. However, many doctors now recognize that women with risk factors should also consider this screening, especially those with a family history of aneurysms or a personal history of smoking. If you're over 65 and have ever smoked, Medicare covers a one-time abdominal aortic aneurysm screening at no cost to you during your Welcome to Medicare preventive visit. Even if you've missed that window, many insurance plans will still cover this screening if you have risk factors. The procedure itself is remarkably simple. You'll lie on an examination table while a technician moves a small device called a transducer over your abdomen. The entire process typically takes less than 30 minutes, requires no special preparation, and provides immediate results. William, a 70-year-old former smoker, had a completely painless 15-minute ultrasound that revealed an aneurysm that was repaired before causing any problems. "I had no symptoms whatsoever," he recalls. "That simple test literally saved my life." This quick, painless test takes just minutes, but could literally add years to your life. Call your doctor tomorrow to schedule it. If you've never been screened and have risk factors, don't delay another day. The peace of mind alone is worth the small effort, and if an aneurysm is detected, you'll have options for monitoring or treatment before a life-threatening emergency occurs. Take action this week to ensure this simple screening is part of your preventive healthcare. Your future self and your loved ones will thank you for this simple, potentially life-saving decision. Topic 3. The critical brain scan. Most seniors never receive the second critical test can detect aneurysms that the ultrasound cannot reach. While abdominal ultrasounds are excellent for detecting aneurysms in the aorta, they cannot visualize the blood vessels in your brain. For that, more specialized imaging is required. Neurologists at the Cleveland Clinic recommend specialized brain imaging tests like CT angiography, CTA, or magnetic resonance angiography, MRA, for those at higher risk of cerebral aneurysms. These advanced imaging techniques provide detailed views of the blood vessels in your brain, allowing doctors to identify bulges or weak spots that could potentially rupture. The CTA uses X-rays and computer processing to create detailed images after a special dye is injected into your bloodstream, while the MRA uses magnetic fields and radio waves to generate similar images, often without requiring an injection. A ruptured brain aneurysm can cause immediate and severe brain damage, with 40% of cases resulting in death and many survivors facing permanent neurological disabilities. When a brain aneurysm ruptures, it releases blood into the space surrounding the brain, a condition called subarachnoid hemorrhage. This can cause sudden, excruciating headache, often described as the worst headache of my life. nausea, vomiting, stiff neck, sensitivity to light, and in severe cases, loss of consciousness. The time between the rupture and receiving medical treatment is absolutely critical. Every minute counts in preventing permanent brain damage or death. That's why detecting an aneurysm before it ruptures is so valuable. The National Institute of Neurological Disorders and Stroke emphasizes that aneurysms found before rupturing can often be treated successfully with much lower risk than emergency treatment after rupture. If you have 2 or more risk factors, such as high blood pressure, smoking history, family history of aneurysms, or certain genetic disorders, ask your doctor specifically about brain aneurysm screening. While these tests aren't recommended for everyone due to cost and resource considerations, they are appropriate for those at elevated risk. Your doctor may not think to offer this screening unless you specifically bring up your concerns and risk factors. Be prepared to discuss your family history in detail, particularly any relatives who have had aneurysms or sudden, unexplained deaths from what might have been undiagnosed ruptures. Susan's persistent headaches were dismissed as stress until her daughter insisted on a CTA scan, which revealed a brain aneurysm that was successfully treated before it could rupture. Her doctor later admitted he hadn't considered an aneurysm as a possibility because Susan hadn't mentioned her family history of circulatory problems. Don't wait for symptoms that may never come until it's too late. Be proactive and discuss this test with your doctor this week. While most brain aneurysms don't present warning signs until they rupture, occasional headaches, vision changes, eye pain, or facial numbness could be indicators of a growing aneurysm pressing on nearby nerves. Even if you've never experienced these symptoms, knowing your risk level is crucial. Write down your risk factors before your next appointment, and don't leave without a clear answer about whether brain aneurysm screening is appropriate for you. This simple conversation could quite literally save your life. Topic 4. The gold standard diagnostic procedure. Seniors should know about what is the most definitive test that can detect even the smallest aneurysms in your body. While ultrasounds, CTAs, and MRAs are excellent screening tools, there is one test that doctors consider the absolute gold standard for diagnosing aneurysms with the highest degree of accuracy. Vascular surgeons at Stanford Healthcare consider the cerebral angiogram the gold standard for diagnosing brain aneurysms because it provides detailed 3D images that can detect aneurysms as small as 1 to 2 millimeters. This procedure, also called a conventional or catheter angiogram, involves threading a thin tube, catheter, through an artery, typically in your groin, and guiding it to the area of concern. A special dye is then injected to make your blood vessels clearly visible on X-ray images. The resulting images offer unprecedented detail about the size, shape, and exact location of any aneurysm, as well as the relationship of the aneurysm to surrounding structures. Even small aneurysms can rupture, and without this advanced imaging, they may be missed by standard scans, leaving you with a potentially life-threatening condition. While most small aneurysms, less than 7 millimeters, have a relatively low risk of rupture, certain aneurysms in high-risk locations or with irregular shapes can be dangerous even at smaller sizes. The American Heart Association notes that the risk of aneurysm rupture depends not only on size, but also on location, growth rate, and individual risk factors. This is why the exceptional detail provided by an angiogram can be so valuable. It gives doctors the complete picture needed to assess risk accurately and plan appropriate treatment. Traditional angiograms also allow for real-time assessment of blood flow, providing functional information not available from static imaging techniques like CT or MRI. If other tests show suspicious results, or if you have multiple risk factors, discuss with your doctor whether a traditional angiogram would be appropriate for your situation. It's important to note that while this test provides the most detailed information, It is also more invasive than other screening methods and carries slightly higher risks, including a small chance of stroke or bleeding at the catheter insertion site. For this reason, it's typically reserved for situations where other tests have indicated a possible problem, or for people at particularly high risk. After James lost his sister to a ruptured aneurysm, his doctor ordered an angiogram that found a small aneurysm that had been missed on previous scans. I was nervous about the procedure, James shares, but knowing what happened to my sister, I'm grateful they found it and treated it before it could rupture. This test could reveal what others miss, potentially making the difference between life and death for those at high risk. If you've had other imaging that showed indeterminate or borderline results, or if you have a strong family history of aneurysms, ask your doctor specifically about whether an angiogram might be appropriate in your case. While not everyone needs this level of detailed imaging, for some high-risk individuals, it provides invaluable information that can guide life-saving treatment decisions. Don't hesitate to advocate for yourself if you believe this test might be necessary for your situation. Topic 5. The simple home assessment that could save your life. There's a simple assessment you can do at home that might alert you to a potential aneurysm. While medical tests are the only definitive way to diagnose an aneurysm, being alert to possible warning signs can prompt you to seek medical attention before a catastrophic rupture occurs. According to research from the Brain Aneurysm Foundation, sudden onset of certain warning symptoms should never be ignored and warrant immediate medical attention. Many people who experience a ruptured aneurysm report having had warning symptoms in the days or weeks before the major rupture. These warning signs, often called sentinel headaches, occur when an aneurysm leaks a small amount of blood before a major rupture. The challenge is distinguishing these warning signs from more common, less serious conditions, which is why a systematic approach to monitoring your symptoms can be so valuable. Overlooking or dismissing these warning signs could mean missing a sentinel headache or other early indicators that an aneurysm is beginning to leak before a major rupture. Studies have shown that up to 40% of people who suffer a ruptured brain aneurysm experience some warning signs beforehand, but many dismiss them as ordinary headaches or minor health issues. The cardinal sign to watch for is a sudden, severe headache that feels different from any headache you've experienced before, often described as the worst headache of my life. Other warning signs may include sudden pain behind or above one eye, vision changes, facial drooping or numbness, difficulty speaking, or unexplained nausea and vomiting. For abdominal aneurysms, watch for unusual abdominal or back pain, especially pain that's constant and not relieved by changing position, as well as a pulsating feeling in your abdomen. Create a headache diary to track any sudden, severe headaches that feel different from normal, especially if accompanied by nausea, vision changes, or neck stiffness. This diary doesn't need to be elaborate. A simple notebook where you record the date, time, severity on a scale of 1-10, location, and any accompanying symptoms will do. Also note what you were doing when the headache started and whether it came on suddenly or gradually. If you experience a headache you would describe as the worst of your life, or one that's significantly different from your usual headaches, don't wait to complete your diary. Seek emergency medical attention immediately. Patricia noticed her headaches were becoming more intense and different from her usual migraines, which prompted her doctor to order a scan that revealed an aneurysm beginning to leak. Her careful tracking of symptoms convinced her doctor to look beyond the initial diagnosis of tension headaches. Start your headache diary today. It's a simple step that could quite literally save your life. While most headaches are not caused by aneurysms, having a record of unusual or concerning symptoms provides valuable information for your doctor. Place a notebook and pen on your bedside table tonight so you can easily record any significant head pain or unusual symptoms as they occur. Then bring this diary to your next doctor's appointment. This small effort requires no special equipment or expertise, just your attention to your body's signals. Remember, when it comes to potential aneurysm warning signs, it's always better to be cautious and seek medical attention if you're concerned. Topic 6. When and how to demand these tests from your doctor. How can you make sure you receive these potentially life-saving tests when you need them? Even if you're at high risk for aneurysms, these critical screening tests won't happen automatically. You need to be your own advocate in the healthcare system. The CDC recommends specific screening guidelines based on age, gender, and risk factors. But studies show that many eligible patients never receive these important tests. There's often a disconnect between published guidelines and what happens in everyday clinical practice. Many primary care physicians, dealing with limited time and numerous health concerns, may not prioritize aneurysm screening unless you specifically bring it up. Understanding how to effectively communicate with your healthcare provider about your concerns is an essential skill that could literally save your life. Without being your own advocate, you might miss out on critical screenings that your insurance would cover, leaving dangerous aneurysms undetected. Medicare and most insurance plans cover abdominal aortic aneurysm screening for eligible individuals, but you may need to specifically request it. For brain aneurysm screening, insurance coverage varies, but with documented risk factors, these tests are typically covered. The key is proper documentation of your risk factors and a clear medical rationale for the screening. If cost is a concern, many hospitals and imaging centers offer cash discounts for patients who are paying out of pocket. Some academic medical centers and research institutions also offer free or reduced cost screening as part of their research programs. Don't let financial concerns prevent you from discussing these important tests with your doctor. There are often options available to make them affordable. Before your next doctor's appointment, write down your risk factors and specifically ask, based on my risk factors, should I be screened for aneurysms? Be prepared with specific information about your family history, blood pressure history, smoking history, and any symptoms you may have experienced. Bring a list of questions and take notes during your appointment. If your doctor seems dismissive of your concerns, don't be afraid to ask for an explanation or to seek a second opinion. It's important to remember that you are the ultimate decision maker about your health. After George's request was initially dismissed, he brought a printed list of his risk factors to his next appointment, which convinced his doctor to order the appropriate screening. I had to be persistent, George recalls. But when they found that aneurysm, I knew that speaking up had saved my life. Make that list of your risk factors today, and don't leave your next doctor's appointment without discussing these critical tests. If your doctor seems unfamiliar with current screening guidelines, politely ask them to check the recommendations from organizations like the U.S. Preventive Services Task Force or the American Heart Association. Remember that medical knowledge is constantly evolving, and even excellent doctors may not be up to date on every screening recommendation. By approaching the conversation as a collaborative discussion rather than a confrontation, you're more likely to receive the care you need. Set a reminder on your calendar right now to make this list before your next appointment. Your proactive approach could be the difference between detecting an aneurysm early or facing a life-threatening emergency. We've covered the 3 critical tests that can detect hidden aneurysms: ultrasound screening, CT or MR angiography, and traditional angiogram, plus the simple home assessment that could alert you to potential danger. Knowledge is power, and now you have the information you need to potentially save your own life or the life of someone you love. Many aneurysms can be successfully treated when caught before they rupture, but only if they're detected first. Comment below with which of these tests you plan to discuss with your doctor, or if you've already had any of these screenings. If this information was valuable to you, please hit the like button and subscribe for more potentially life-saving health information tailored specifically for our generation. Share this video with someone you care about. It could literally save their life by alerting them to tests they may need.